If you're on a retiree health plan and you think you do not need to start Medicare, that is where so many people get this wrong, and it can lead to lifetime penalties and permanent decisions around the retiree health plan. In this video, I'm going to talk about how Medicare works with retiree health plans, the decisions that you need to make amongst those plans and when to do it, and the biggest mistakes that we see people make in this situation when they have a retiree health plan and Medicare. Hi, I'm Joseph Pate, better known as Medicare Joe, and every day we work with individuals that are retirees and getting onto Medicare. A lot of these people still have a retiree health plan. It's important to know that this works differently than if you had employer-based health coverage. So in this video, I'm going to dive into those few points that you need to know if you're a retiree, on a retiree health plan, and have Medicare. So number one, the simplest thing that we can start with is if you are not covered by an employer-based plan and actively employed, or your spouse is actively employed and you're on their plan, when you turn 65, you need to start A and B of Medicare. And what happens is your retiree plan goes from being your primary health insurance to becoming secondary to what Medicare is going to cover first. So Medicare would become your primary insurance A and B, and the retiree plan would be a secondary insurance, acting almost like a supplement to your Medicare. Which leads me to my second point. It's important to do some research on this because more and more retiree plans are changing with how they're structured for people over 65. There's two types of ways your retiree plan can work. One way is the traditional way where you have original Medicare as your primary and the retiree plan as a secondary, giving you full coverage, similar to how a Medicare supplement would work. The second way now, which has become more and more relevant with Medicare Advantage, is they basically take that retiree plan and they turn it into a Medicare Advantage plan that's not offered to the public. It's basically a private Medicare Advantage plan that only you and your retirees have access to. The reason why you need to know which one yours is going to be set up as is because they work very, very differently when it comes to the coverages and the exposures you're going to have on your plan, as well as flexibility with doctor networks, etc. Now, once you know how the plan is set up, the third key point I want to make mention of is that with these retiree plans, they work in a way where if you ever give them up, you can never get back on them. But just because you have the option to take that doesn't always mean it's the best option for you at the end of the day. So when you have a retiree health plan, think of it as you just have one extra option than everybody else has when they're getting onto Medicare. So you're still going to want to compare that one extra option to the other two that everybody has. And what I mean by that is you have the option of original Medicare with a private supplement as one option. You have original Medicare with your retiree plan as your second option. And then you have Medicare Advantage as your third option. It's important to compare the costs, the coverages, the networks of doctors, how flexible the plan is with prior authorizations, etc., before making your decision on which one is going to be best for you. Now, regardless of the decision that you make, any of those three plans are going to have gaps. And this is where people get this wrong all the time. They think that I'm going to get onto Medicare, I'm going to have my retiree health plan as my secondary plan, and I'm good to go. That is where it's important to understand that your Medicare and a retiree plan is very similar to Medicare and a supplement plan. It can be really good coverage, but you're still going to have gaps. And that's why 70% of people that are on Medicare carry additional coverages for the gaps. And what I mean by that is cancer, heart attack, and stroke coverage for out-of-pocket costs. I have a video linked below on why Medicare falls short of covering a lot of that stuff. Hospital stays, recovery care, long-term care, assisted care is not covered by Medicare in these retiree plans, just like Medicare with the supplement. So how does that get covered with additional options? I have another video linked below on where Medicare drops the ball on that one. So just because you are getting onto Medicare and you have this retiree plan, It is not a plan that's going to be drastically better than anything that's out there. You're still going to have exposures, and a lot of those exposures, you need to enroll into them or have an idea of if you want to enroll into them prior to 65, or some of them are just based on your health. So don't miss out on an opportunity to educate yourself on these exposures just because you have Medicare with the retiree plan. So to recap in this video, I want to make sure we highlight a couple key points. Number one, if you have a retiree health plan and you're turning 65, you need to start A and B of Medicare. Your retiree plan will then become a secondary insurer to you. If you do not start A and B, you will have penalties for not having creditable coverage. Number two, you need to understand what type of retiree plan is it that you're getting onto. Is it a Medicare Advantage policy, or will it act like a Medicare Supplement plan? Number three, this retiree plan is usually a one-way route if you were to give it up. So giving it up means that you cannot get it back. Doesn't mean you have to take it or should take it 100% of the time, but just know that when you leave a retiree plan, you typically can never go back to get it again. And lastly, with any coverages with Medicare, retiree coverage included, there may still be gaps that you can get covered that will impact you later in life, even though you have this retiree plan as a secondary insurer. If you're on Medicare or about to be and just want to make sure you're getting all of this right, there's a link below. You can book a call with one of our team members. They will walk you through your situation and make sure you're making all of the right choices. If you are just here for education and like this video, please hit the like button so it'll push this out to more people that need this information. And again, if you are just in the researching phase of Medicare, click that red subscribe button. You'll be notified anytime we post new Medicare educational videos, which we do weekly. Thanks for watching.